The more we feel like we have control over our lives and our health, the better able we are to make decisions that are healthy and, increase our well-being and so on. Self-efficacy. Self-efficacy is critical. So I've worked a lot to be able to explain concepts so that people can understand and make their own decisions. I think it's critical, really critical for health and well-being. So disparities by definition are differences. So there are differences that exist. And I think that disparities doesn't accurately reflect what is actually going on, because the differences exist because of inequities, health inequities, um, policy inequities, institutional and organizational inequities that really have led to a legacy of trauma and neglect for specific populations in our society. African Americans have this legacy of trauma and abuse. Native Americans, Latinx, and then if you look at the abuses towards the LGBTQ community, those can be documented as well. And then the more devalued identities you have, the more likely you were or are to be on the receiving end of those abuses and injustices and indignities and inequities. And so what that does is it creates situations and circumstances that place individuals at increased risk of HIV exposure. And we see it even now with the disparities that we're seeing, the inequities that we're seeing with regard to the distribution of COVID. And any new disease, infectious disease that comes along will play out in very much the same way for these devalued identities, because we have not created infrastructures that effectively prevent infectious disease in communities, and actually have created situations and circumstances where the exposure to infectious diseases is higher because of densely populated areas, largely based on things like redlining and segregation, which has placed communities of color in higher density areas with fewer resources in those areas and less capacity, less access to clinical care and nutritious food, and a whole list of other things that place people at differential risk. You don't have to tell anyone who's got a devalued identity that these things aren't true, because we live them every day. But the fact that we have now like longitudinal and cross-sectional data that proves beyond a shadow of a doubt that these things are having negative impacts on our health, and that they continue to have negative impacts on our health, it's irrefutable that we need to do something about the long-standing systemic racism that continues to perpetuate our institutions and organizations if we are going to have any impact on the current health inequities that we see. And what is happening today even is that we want to pretend that hasn't happened, and that somehow, even in saying that these things happen, it's somehow un-American or makes me a reverse racist because I want to talk about what happened that brought us here, and really look at how we might be able to address it and change our reality. And instead of seeing that as a good way forward, certain individuals are trying to sort of show that as being un-American or unpatriotic, which, is definitely like several steps backward. A lot of people are like, well, why are African Americans so much more at risk? And a lot of it has to do with what we talked about before, this legacy of violence and victimization. But a lot of it also has to do with the fact that we are indeed a minority. And what happens in communities is that often we choose choose partners that are like us, that look like us, that share our identities. And more often than not, African Americans, when they choose sexual partners, are choosing another African American sexual partner. Now, let's back up a little bit and think about what that means in the context, for example, of a place like Seattle, which is where I am. So here in Seattle, African Americans make up about 5% of the population. So if you are an African American looking for an intimate or sexual partner, and you are a cisgender heterosexual woman looking for an African American partner, you have about 2%, a little over 2% of the population to choose from. If you are an African American man who has sex with men, you have less than 1% of the population. So think about that. Out of 100 people that you meet, like half of a person is a potential sex partner. So out of 200, you got like one person if you are looking for someone who shares your same racial identity. And so what happens when you have such a small group of individuals is that your sexual network is small. So anytime anything gets into that sexual network, like let's say, someone's in a relationship and they sort of dip out on the relationship and might be exposed and haven't been tested, and they expose their partner, the viral load in that community increases exponentially. When you're talking about a group of 100 people and one or two people get infected and they're overlapping partnerships, the spread of that virus is going to be much greater than if you're talking about a sexual network, for example, that might have 20,000 or 30,000 people in it. Huge difference. And so when HIV gets into a sexual network, a small sexual network, it is much more likely to have a greater growth anytime anything happens. So if they're overlapping sexual relationships, if someone doesn't know their status, and more African Americans don't know their status than their white counterparts, largely because of our strained relationships with the medical system. I was invited to a transgender transgender awareness celebration, to speak as a cisgender heterosexual Black woman. And one of the things I said there was, why am I, as a cisgender heterosexual woman here? Isn't there a transgender person here? And from that, several of the transgender women in the audience have reached out to me since then. And the information that I gave at that talk, we're now going through, and they've got my slides and they're going through it, and we're meeting to really ensure that they have the information that they can impart to their community, so that the next time there's a transgender awareness, they can be the keynote speakers. And I think we need to do that for our communities, and to really ask those questions, like who's speaking for us, and why hasn't the capacity been available so that we can speak for ourselves and that we can have the information that we need to better improve our lives. And I think one of the ways to do that is, to find, transgender individuals and LGBTQI individuals generally who are doing the work, and work with them to help build capacity. I mean, one of the unfortunate things about having devalued identities, well, fortunate or unfortunate, depending on the way you look at it, is that you are often, the one who's got to move it forward, because we can have allies, but in the end, I think a lot of the work to move us forward comes from us.